All righty, good morning.
Good morning.
Morning.
Welcome. We're very glad to see you all here. It's an important day for New Mexico workers.
Yeah.
And actually, please, as you arrive, if you want to introduce yourself in the chat, I know that means the people who come after you. Well, it's 11 o'clock, so great. Please introduce yourself in the chat. We'd love to know who's here. Welcome. Great. Shall we put the opening slide on the
Kelly, can you
screen?
check your chat, please?
Yeah, I did.
Yep, I'm about to share the slide. All right, should we go ahead and get started? Sounds good. Thank you all so much for joining us. My name is Justin Garut. I am the climate and energy advocate at Conservation Voters New Mexico. I am so excited to have you all here. This is very exciting to me in a very nerdy way. I hope it's as exciting to you all as it is to me. We would love to have you put your name and organization, anything you'd like to share in the chat. If you didn't register for this event, please feel free to add your email as well. And we're gonna hold the end of today's session for Q&A, but if you do have a burning question that you just can't hold on to or you might forget, you can feel free to put that in the chat as well anytime during the session. We have Christine here as tech support helping us out. So if you have any issues or need help today, her information is in the chat as well, Christine Winfield. All right, so I think I'm gonna go to the next slide. We want to first of all thank everyone for being here, all the workers in New Mexico that keep our state running. You know, we appreciate you and we are here to try and protect you and your health and save lives ultimately. I also want to give a special shout out to all the advocates for worker health and safety. I'll go through a list of partners in just a second. New Mexico Environment Department, thank you so much for being a leader on this important issue, for taking this up. It's not lost on us that you don't have to do this. There's nothing requiring you to do this, and you are moving this forward on your own accord. You have petitioned the Environmental Improvement Board, and we're very grateful for that. And thank you to each one of you who joined today. I think we have almost 50 folks. That's exciting. I think we'll be stronger together moving forward on this campaign. So here are some of our advocacy partners and hosts for today. We have Healthy Climate New Mexico. Shelly is here. Shelly, do you want to say a quick intro?
Oh, thank you so much. So I'm Shelly Mann-Lev. I am the Executive Director of Healthy Climate New Mexico. I think many of you are familiar with our work. We are an organization of over 270 healthcare and public health professionals. And this is a day that we have long awaited. We've been advocating for this heat standard for the past several years since we started, and really thrilled to be here and thrilled to have all of you.
Thank you so much, Shelley. And then I mentioned that I'm here from Conservation Voters New Mexico. We also have Anastasia from the National Employment Law Project helping us out hosting today. Do you want to say a few words? You don't have to. Welcome.
Nope, I'll be talking plenty in a little bit.
You'll be talking
Thanks.
later. Okay. And then we have the New Mexico Center on Law and Poverty working with us, CAWA, the New Mexico Legal Aid Farm Worker Justice Program, AFL-CIO New Mexico, as well as National. We have AFT New Mexico and the Blue Green Alliance, as well as La Isla Network. So the occupational heat standard, it's been kind of this thing for a little while. You know, you can see here in the beginning, 1972, 86, 2016, the National Institute for Occupational Safety and Health recommended to OSHA at the federal level, hey, y'all should adopt a heat standard. A couple years later, in 2021, OSHA kicked off a rulemaking process for a heat standard. And then there was some advocacy work urging New Mexico, for New Mexico to protect workers from heat as well. In 2023, 2024, New Mexico Environment Department developed and proposed a rule based on the state and national data and on OSHA's proposal. And then at the federal level last year, July 2nd, 2024, OSHA released a text of its proposed standard. However, we had a big administration change at the federal level, and the work on this standard at the federal level is not going to move forward, which opens up a huge opportunity for us as a state to protect our own. And that's where we are right now, with on March 13th, 2025, NMED petitioning the EIB, the Environmental Improvement Board, to adopt a state standard regardless of what's going on at the federal level. We can take action, and that's what we're here to do today. So we're not alone in this, but we would be a leader if we adopt this, or I should say when. We will be a leader when we adopt this. 7 states already have heat standards. You can see them in the darker blue color here: California, Nevada, Oregon, Washington, Colorado. Is this Michigan? Minnesota. I was close. I know the Midwest and the Eastern Coast is like a blur for me. So please forgive me. I'm a Western born and raised. Here's our agenda for today. We did some intros. We're going to go through impacts of heat on workers' health. We're also going to talk about what kind of New Mexico workers are at risk, look at the proposed heat standard. NMED is going to share about public input opportunities and timeline. And we have a call to action for you, and we'll save Q&A for the end. Shelley, did I miss anything?
You got it. I can tell.
I got
we're
it?
on a roll. Yes, thank you.
All right, I'm going to stop sharing, and we're going to watch a little bit of a video that kind of highlights why this is so important, as well as gives a good example of an employer who really cares about their employees.
Not hearing the sound.
My name is Frank Muller. I've been farming in Yolo County, California. I've been doing this for a little over 40 years. The most important lesson that I've learned over the years of farming is there's a new lesson every year. Every year is so different, very humbling occupation sometimes, but sometimes you think you have it figured out and there's curves that are thrown your way. So it's a constant challenge, but that's really the thing that I like about it most. So I have this philosophy of my employees. I consider them to be professionals. They've been at this job, many of them, for years and years. It's supposed to be 102 degrees outside today. As bad as the weather can be sometimes, it just presents a different challenge to you. And what are we going to do to get through this? And how are we going to learn from this experience and not be affected by it as much next year?
When it's 110 degrees outside, probably in the field they can go to 110 to 115 or 16 degrees. You don't got water. You can dehydrate easy.
the challenge with heat illness and what it can do to a person has just made us more aware of what we have to do to keep our workers healthy. If you're working in the fields and you don't have access to water, access to shade, you can become dehydrated and subject to heat illness very, very quickly.
I think the data are pretty clear that the choice to stress the workers and cause the heat illness is the least profitable choice, just in dollars and cents. If I've hired 20 people, there's a cost to hiring, and then if 3 or 4 of them are sick or can't work, I have that cost over again, or maybe I don't get the crop harvested, which is a huge loss.
It's important to protect your farm workers' health and safety because I need them on my farm every day. I need them to be healthy. I need them to be happy. I need them to show up and to be able to make a living that they can provide for their family. And I told the story many, many times about we built trailers that are like a mobile picnic table with a shade structure on top. And when we first built these things, we were kind of thinking, well, is anybody ever going to use these? And the first one that came out of the shop, I brought it out to the field and set it up in the field. And I was shocked because within 10 minutes, everyone had their lunch on the table and their water jugs on the table. And it was a resource that we weren't providing, that there was a need. One of the reasons that I do what I do is because we read about the lack of people that want to work on farms. I don't have that problem. Why don't I have that problem? Because my farm is known as a good place to work. I have people coming and applying for jobs on my farm. And the reason that they're doing that is because of word of mouth. There's a lot of the agricultural workers in the community and their friends. They talk about where they work and what their bosses are like and how they're treated. And they know where the good places to work are. I think it's a great business philosophy to take care of your employees because I have really great employees and I have all the employees that I need. And when I want more, I can find them. And that's really different from a lot of other farms. And the farms that have problems finding employees are usually the ones that don't treat their workers right. So what would I say to other farm owners about implementing heat illness training and safety is like, why aren't you doing it for the safety of your workers, the health of your workers? It's not very expensive. It's not hard to do. And it's really the only right thing to do with your employees.
All right, thanks so much for showing that video, Christine. I'm going to go ahead and reshare my slides and we're going to go on to our next presenter. I think you can see those. All right, I have the great pleasure of introducing Dr. Fabiano Amorem from the University of New Mexico Exercise Science Program, who's going to talk a little bit about some of the health impacts of heat on New Mexico workers. Take it away.
All right, Justin, thank you very much for the introduction. Thank you, Shelley, again for the invitation and Healthy Climate New Mexico. It's a pleasure to be here, especially talking a topic that I have interest and a topic that I have been dedicating, and I'd say probably the last 6-8 years, and the last probably 3 or 4 years more to the construction field in the US, in New Mexico, as you're going to see it. Next, please. And I just want to say that I have no financial disclosure or conflict of interest with the material presented here, to make clear that I don't have sides on what I'm presenting here today. Next. To start talking about heat stress and health in workers, we need to understand the current scenario that we live. And the current scenario that we live is that heat is the leading cause of death among all hazardous weather conditions in the US. And then you can think like, okay, but we're talking about workers. And then when we go to the next level and we look the workers data, we have like 1,042 US workers deaths from 1992 to 2022. People can think like, oh, that's not many, like that's like 40. Probably a year, still 40 lives. But something that's very important to add to this data, it's probably underestimated, or for sure underestimated. And when we look at the data about the work-related heat injuries and illness, we have 33,000 from the last like 9 to 10 years. And then that's also underestimated. It means it's a big topic. We need to pay attention. And since we are in a state that we know that heat is a problem, we have to take our actions. And I think that's the reason we are here to discuss about the New Mexico standards. And I want to share some of the basics and then some of the data that I have collected in the field in New Mexico. And then I think it's the first in the US, the data that we have collected here at UNM. Next, please. When we talk about heat stress, I want to bring the scenario. This scenario is going to vary depending the worker place. Let's say if it's in a field like in agriculture, as the video that was placed, is going to be a little bit different. But in general, we have like this construction worker working in a roof. Basically, there are source of heat that's making this worker gets hotter. And then like we can see like solar radiation, the temperature of the air. If there is like humidity makes like harder for the body to dissipate heat. If you have like less on movement of air, that's like let's say like the wind, it's not gonna help you to dissipate heat that you're creating in your body. And then on the other side, we have also heat production in our body. And how we produce heat in our body, we produce heat through the contraction of our muscles. Like when our muscles contract, we need energy. That energy comes from food. Basically, we break that energy that we store from food, and then 25% of that energy goes to make like the work that we are doing. 75% is dissipated as heat. It means if we're getting heat from the environment and our body is producing heat when we are working, what's going to happen? Our temperature goes up. And then we have to activate mechanisms to dissipate heat. And basically we have vasodilation. That's basically getting the blood to the skin, and then sweat, that's when is evaporated, help us to cool down the body. And in New Mexico, although we have a hot climate, we favor sweat. That's the major mechanism. Of course, that makes people more dehydrated. Next, please. And when we put together the environmental heat stress or the environmental heat that we are getting, and then the metabolic heat that we are producing, and then let's say the environment, we are not dissipating heat, what's going to happen? We're going to build up heat in our body. And then we basically, our body needs is going to try to dissipate this, activating the cardiovascular system, activating like mechanisms to keep the water into our body. But usually what's happened, it brings hyperthermia. And hyperthermia is basically increasing your temperature. Not all hyperthermia is bad, but if we reach like certain thresholds, like for example, 38 degrees Celsius or 100.4 degrees Fahrenheit, these are the recommendations for workers that have been like in a daily job. They should not be exposed above this threshold. Next, please. And we know that when workers are under hypothermia, they're a risk of heat illness, as that we're going to discuss. Like there are several heat illnesses. Like let's say, for example, a worker has cramps, and then they have been exposed to the heat. Usually that's called heat cramps. Why? Because you have been dehydrated. And then you have an electrolyte imbalance, and then that's going to affect the ability to the muscle to contract. In certain, I would say, jobs, like for example, agriculture, especially sugarcane workers, they have like these heat cramps all over their body, just to have an idea. Like usually we see like an athlete or a worker like in a certain part of their body having cramps. Like in more extreme case, you can have in the whole body. And then we have the most extreme heat illness, that's the heat stroke. And basically, that's like the most advanced that affects the cognition of the individuals. The temperature is high, and the mortality is very high for when that happened. Associated with that, we have like AKIs, that's an acute kidney injury or chronic kidney disease that has been described in people that have been working under chronic hot conditions for a prolonged period of time. And then also accidents is higher or are higher when people are exposed to the heat and they have hyperthermia. And then as think that we discussed last, productivity is also reduced. It means there is a body of issues that the workers have to deal when they are exposed to the heat. And that's a big topic for us. It's a topic of interest. It's a topic that we have to discuss because we are talking about lives at the, sometimes at the limit, at the threshold. And then that's a topic of interest for us. And then the New Mexico standard, heat standard is probably on the best approach we have now to protect our workers. Next, please. I want to bring the study. This study was published this year, and you're probably going to be surprised. That's the first study published in the US that has been measured core temperature of a worker. What is a core temperature? Basically, is the temperature of their body that I just talked before, like using a valid method. Most of the time we use like, in the field, we use tympanic temperature, we use like skin temperature, but those are not valid ways to measure. In this study, we measure using a capsule, the internal body temperature. And this study was conducted in Pecos, New Mexico, in 2023 in the summer. And I'm going to show some of the results that we observed with this study. Next, please. This study was conducted on a bridge on reconstruction. Like they were kind of on an I-25. They were like work on this bridge. They were having like doing some concrete work that day. It was only for one day. We had only 7 workers. And basically, we measured the heat index of the environment during the summer. It was not a very, very hot day. As you can see, like 91 was the highest temperature we observed in the field. And then next, you're going to see the core temperature of these workers. These workers, they were not very hot, as you can see it. Most of them were below the 38 degrees or 100.4 degrees Fahrenheit. Only 29% of these workers were above that threshold. Unfortunately, we were not able to measure, specifically in that study, their physical activity levels. And one of the things that people are probably curious about the New Mexico standard with this data, and we can discuss this later, based on the heat standards that we have now, were these workers allowed to work for the time that they worked? And I'm going to let that for our discussion on next. But I just want to finish here that we have conducted data or studies in the last 2 summers. We have already very interesting data that we're going to share on the major public or audience that's interested in our data. We have data from construction like large sites outside New Mexico, and that I'm going to be able to share this data soon that we collected in the last summer. I just want to finish here just to say that it's an important move that we need to make, and then now we need to discuss how this is going to impact different companies and different jobs, and see what are the public opinion for this. And I'm here to support. Please, next. And I just want to appreciate the people that and the institutions that have supported this work, like UNM, Indiana University, LAISLA Network, and then also the CPWR, that's the Center for Construction Research and Training in NIH that NIOSH that supported some of our work here that I presented. And thank you again for helping me to show this data to you. And I'm going to transition to Barak. Barak, you next.
Thank you so much, Dr. Amorim. I have the pleasure of introducing Dr. Barak Al-Ahmed. Dr. Al-Ahmed is a research fellow at the Harvard School of Public Health and is going to talk a little bit about who's at risk. Take it away.
Right. Thank you so much. It's good to be here. I come from the Harvard T.H. Chan School of Public Health. I teach about extreme heat and health, and also research productivity. This is not my slide. Where is it?
Justin, go back 2 slides. No, go back.
I can talk about these other
That's
slides.
Good, thank you.
Thank you. I thought long and hard about what do I want to talk about today. And if there is one message that I want to deliver, in addition, because I also saw Fabiano's slides, he sent them before me. So I looked at it, it's like, okay, what can I add to Fabiano's great slides? And I thought there is one question that we always face in the science. And that question is rest breaks. rest are essential in cooling the bodies down when we are overheated, when our bodies are overheated, and they are essential parts in any regulation. The OSHA regulation, the other states that included heat standards, all of them, they include rest. So La Isla Network, which I work very closely with, Fabiano as well, through their Adelante initiative in Nicaragua, did a comprehensive study. They have a cohort of workers working in agriculture and sugar farms. They followed them from 2012 until last year. And they have been taking measurements from the core body temperature, working very closely with the sugar farms, and collecting all these data together. They proposed 4 interventions. One of them is rest breaks. The other ones, like the ones that we saw in the video, shade, water, sanitation, and other things that are also extremely important. But let me talk about rest breaks. In 2012, 2013, if you see that yellow line, it shows you how many hours the workers used to work in these farms. And they used to work 8 hours a day, right? And in the blue line, this is their productivity. This is how much metric tons they produce per day. And then when we started to implement these interventions, this meant that they take more rest breaks, so they work less hours, but look what happened to their productivity. And their productivity, the average metric ton produced per day, just kept increasing, and it doubled. By 2022, at the end, you see 1.57 metric tons per day. Compare this to 0.8 when they were taking no breaks. So what is going on in here? And why do we think this is really important? Because think of productivity. How do we measure productivity? This is like a very big term. But in agriculture, we can actually have a very objective measure of productivity. And you know what it is? They collect all the the crops that they did. They put them on a scale at the end of the day, and they get paid by the piece. So that exactly gives us a very objective measure of productivity. And the data doesn't lie. It shows that the productivity actually doubles when the working hours go from 8 hours a day to as less as 4.7 hours in a given shift. So that is immense. This shows that when you rest, when you regather your concentration and go back at it, and we've seen this in exercise literature, we've seen this in biology, we've seen this everywhere. So it's common sense. We know about this. But now we have the data that shows this. So for all those nervous businesses and people that are thinking, oh, how do we incorporate these rest breaks that you're asking us to do? Well, look at the data. The data shows if you give rest breaks at the right time for your workers, they produce more. They become more productive in addition to being safe at the same time. So I will stop here. I think this is the message that I wanted to deliver. Take a screenshot of this and send it to the people that are very nervous about the rest breaks. Tell them rest breaks are a good thing for business and good for workers as well.
Thank you so much, Dr. Al-Ahmad. And thank you, Dr. Amorim and Justin. I think part of what we want you all to see is the incredible technical expertise. I mean, we know that science matters, and there is science behind these standards. These aren't just some, dreamed up idea. So again, I'm Shelley Mann-Lev here with Healthy Climate New Mexico, and I just want to briefly share who's at risk. Next slide. So heat is obviously impacting many workers, both indoor and outdoor. When Justin said we have 7 states, some of them only protect one small group of workers. A couple of them are comprehensive. And our goal here is for New Mexico to set the standard, obviously to protect our workers. If you go to the next slide, to protect all of our workers, and also so that other states can model after us. Wanted to highlight the work that our New Mexico Department of Health has done with very limited resources, and thank you to Stephanie Moraga-Micheli, who's on this Zoom, and also to Chelsea Langer, who's continuing the work. We actually measure heat-related mortality, the tip of the iceberg. I know it's a funny metaphor, right? Iceberg when we talk about heat. Anyway, the tip of the iceberg, deaths from heat and those hospitalizations that are heat related, it is not all the things that heat contributes to, but those that are documented as heat stroke, sun in the diagnosis in the ICD-9 code. So you can see that we have substantial numbers of hospitalizations. This is just a brief time period, and that 2/3 of them are for people in the working ages, right? 18 to 64. We don't know exactly that they're heat related, but 2/3 of those hospitalizations. Next slide. You know, we also, again, challenges in collecting data, but we do know that since the federal OSHA asked us to collect information on complaints, that we have received about 150 heat-related complaints from workers. And again, that there's some, and that those deaths keep going up because, of course, heat is going up. You know, we're not talking about overall climate change trends, but we all know record-breaking heat months and months in a row, and that is only going to continue. Next slide. A few of the stories I wanted to highlight from those complaints to our own OSHA. Workers in a convenience store. These are indoor workers, right? Our proposed standard has to cover indoor and outdoor workers. Went without air conditioning for a month, high temperatures. It's not just in the southern part of our state, and they felt dizzy, nauseous, lightheaded. Lots of teachers, if you ask anyone you know who's a teacher, they'll, most of them will tell you stories about heat. Municipal waste workers on site didn't have adequate protective equipment or hydration. You know, those 4 things I heard what Barak was emphasizing, Dr. Al-Ahmad, I feel like with all your credentials, but of course, breaks, we need those rest, we need shade, we need water, and we need training and written work plans. But municipal waste workers who didn't have adequate protection or water, who were threatened if they reported safety issues. The standard needs to protect our workers who do report complaints. Of course, many agricultural workers exposed to sun and heat while doing their work experience heat-related problems. They're at some of the gravest work, construction workers, and as well, people who work in schools. Next. It is estimated that about 250,000 New Mexico workers work in high-risk industries for heat, and we want to see them protected. Next. Dr. Amorim was talking about the different kinds of conditions, and again, we want to protect everyone, and especially those people who are pregnant, people who have other coexisting conditions. We don't want them to be discriminated against in terms of jobs, but when we protect everyone, we protect them. Next slide. And I just wanted to highlight, this is information about our New Mexico workforce, and you can see from this chart that we have a large, and we know we do, trade, transportation, utility sector. Construction has almost 80,000 workers. Of course, those people who work in our oil and gas fields are at very high risk. Schools, as I mentioned. In terms of farm workers, we have about 20,000 paid farm workers, and there are other industries. This is a health equity issue. And that's part of, the people who are people of color, people with other health challenges are often working in these most high-risk industries. And now I'd like to introduce Anastasia Christman, who's going to share about the proposed standard.
Yeah, thank you, Shelley. I'm Anastasia. I work for the National Employment Law Project. We're a national nonprofit advocacy group for mostly underpaid workers. And I do a lot of our climate justice work. So lately it's been a lot of work on heat rules, and I've been working with folks in a number of different states and at the federal level, thinking about how to do really effective heat rules. And I just want to sort of start off by stressing that the one that the New Mexico Environmental Department has proposed is really strong. It's very good. They've clearly done their homework. They went through existing standards and the proposed federal standard and incorporated a lot of the best practices that we know work. California, their standard has been in place for 20 years. We do know what works. We heard a lot about what works in presentations earlier this morning. So I do want to give them credit for that. And Justin, if you could hit the arrow. I do also want to emphasize, though, that with a few changes, it could be even better, right? And so I just want to go through for a few moments some of these parts of the standard that are really strong and some ideas we have on how to improve them. And I want to emphasize that this is not work I'm doing alone. Several people who are on this call from the AFL, from Blue Green Alliance, Barack, we have all been going through this with sort of a fine-tooth comb and trying to think about how to help NMED make it really the absolute strongest standard possible for workers. Next, please. So it does have broad coverage to protect virtually all of New Mexico workers. As Shelley was saying, it covers both indoor and outdoor workers at one time. Other states have done them half and half, and it's inefficient. It sets the initial trigger temperature at the heat index of 80 degrees and has high heat condition provisions at 95 degrees. We know that these are temperatures where the body can start to feel these effects. And having the two levels is really important. It only exempts buildings or other structures that have mechanical systems that keep the temperature below 80. Some of the stories, the narratives that Shelley shared from those complaints about heat talked about broken air conditioning. There was one where the air conditioning had been broken for a year, which I would argue means they don't have air conditioning. This is saying, that mechanical temperature will protect people, and it only exempts emergency workers while they're on emergency response operations. We know that public safety officers most often suffer heat-related illnesses during training, not during response to an emergency. So this is really important. If you could advance for me, Justin, and again. So there are a few things that we could improve. We need to be really clear about exposure to direct sun. That is a major effect about New Mexico's weather. We need to really talk about how that plays into trigger temperatures, and we should have specificity about how personal protective equipment can be part of calculating the trigger temperature. Forward. The buildings and other structures, that exemption for them, that should only be in place while those things are working. When their mechanical systems are not functioning, they should be expected to adhere to all parts of the standard until they fix them. This is also incentive to fix them. So we should just make that very clear in there, that they are expected to take care of workers when those systems are not functioning. And forward. And similarly, delivery vehicles with air conditioning, they should be exempt only if the drivers are not in the uncooled part of the trucks, sorting packages or delivering packages to doorsteps for more than 15 minutes out of every hour. When we do go through national data about injuries, we see that delivery drivers are like collapsing on front yards. Homeowners are calling emergency services to protect them. So we need to be really clear about when exemptions come into play. Next, please. So another great thing is that this standard is going to require mandatory written plans and worker training. And it's really positive that NMED has been specific that all of this needs to be in languages that workers are comfortable in, and those written plans have to be easily available to them. And it stipulates that workers have to have annual training about all these signs of heat stress. They're going to learn all of the things that Fabiana was teaching us about this morning, how to recognize heat stress, what are the best practices to protect yourself, what are the emergency procedures. These are very strong parts of the standard, and we're really glad they're there. Justin, and again, could be even better. Workers should be part of writing these plans to make sure it addresses real life workplace conditions. They do this job every day. They know where the heat is the worst. They know what kind of work makes them the hottest. We should be taking advantage of that expertise and involving them in writing the plans. And it should be specific that the trainings have to be in person and they have to be given again if there are any serious heat-related illnesses or fatalities on the workplace. If somebody got hurt, the training wasn't working right. So let's do it again. Let's make sure it's in person and let's make sure people can ask questions. This is complicated stuff. So let's make sure everybody knows how to keep themselves safe. Next, please. Oh, thank you. And the training should also include the vital emergency measures that a worker can implement to save a coworker if they're suffering from heat stroke. So the emphasis on the preventive rest breaks, this is to try to keep people from experiencing heat stroke, the very worst of the injuries that we heard about from Fabiano earlier. But if those things start happening, if somebody on the site does in fact start experiencing those really serious effects of heat, everybody has to have training on the vital emergency measures that they take while they're waiting for emergency response to get there, immediately cooling the body. Right now, the training is a little vague on this, and we're working on language to suggest that we could make it even stronger to make sure everybody knows what to do. Next, please. Training should also include know your rights language. So one of the stories that Shelley shared was about the the sanitation workers who are afraid of retaliation for reporting. New Mexico has a good, strong law that says that workers who report labor violations cannot be retaliated against. It's really important that workers hear and are reminded about that law from their employer as part of this training. The way that OSHA functions is that workers have to feel protected enough to talk about violations in the workplace. And so we really think non-retaliation language is super important to have in there. Next, please. So another really strong thing is about the mandatory use of proven methods to avoid worker heat stress. Barak mentioned one of these at some length, rest. There's also the provisions for water, shade, cooling rooms on site to protect workers, acclimatization, which is letting people slowly get used to working in the heat, not sort of throwing them right into the deep end of the pool right away. And it does call for some record keeping so we can start to address these data problems that everybody has mentioned today and really know how many people are suffering from heat-related illness. Next, please. And again. So again, a couple of improvements. There needs to be more detailed language about some of these provisions. How far away is the water? What are the parameters of the shade? We want to make sure that workers don't lose income when they protect themselves. The rule does say that the rest break should be paid, but we need to be a little bit more specific and help employers know how to calculate that. Next, please. The rules should also really clarify about workers with labor agencies, staffing agencies, and temporary agencies. OSHA law governs employers, and it governs workplaces where employers have control. But we know that very often workers are on site doing work under employment arrangements that means that they don't get their paycheck from the person who controls that work site, but that person controls the work that they're doing. So there are some places where we can pull in some language to make sure that these workers don't fall between the cracks and somebody is making sure that they are acclimatized and get the training that they require. Next, please. And then we think that employers should get real guidance on what constitutes a heat related illness that demands reporting, and that when the temperature is high, we should presume that all injuries, slip and falls, mechanical difficulties, we should presume that all of them have some relation to the heat. There is a lot of research that shows all injuries go higher when the heat is higher. This is super important, again, so we can start to get at what causes these injuries and how do we prevent them and get that data together. Employers shouldn't be expected to know how to do this themselves. The guidance should be in the rule for them. Next, please. And then the final thing that's on here, it does call for emergency medical care when fast action is vital. I mentioned earlier that workers need to get training on that. It's really good that it calls for the employers to have plans, what to do. And it's really good that it calls for workers to recognize heat-related symptoms in themselves and others. Next, please. Again, thank you. But the regulation needs more detail and clarity about what does this effective emergency response look like. It cites to some other areas of law about first aid, but heat isn't really included in those first aid measures yet. So we need to make sure that those rules are right in here. And so people know what to do and employers know what to do. We can only expect them to comply when they know what the rules are. And next, please. And then workers need a lot of training and information about the health conditions that they may have that can increase vulnerability to heat, and how the PPE that they wear, the personal protective equipment that they wear while they're doing their jobs, similarly can increase vulnerability to heat. So we think that the more information workers have about themselves, the better prepared they are to recognize when they're starting to suffer and to ask for those breaks and to get the water and to sit in the shade. Next, please. So I'll just sort of close by saying that New Mexico really is on its way to drafting and implementing a standard that's going to go a long way to protecting all of these workers. One of the things we knew from the federal OSHA standard is that when these kinds of protections are in place, heat-related injuries can be diminished by about 65% and fatalities can be all but eliminated. So this kind of standard really can help keep workers safe and really can help employers know what to do so they can be more like the guy in the video who cares about his workers and takes care of them. So I just want to really sort of reiterate the appreciation we've heard today for the NMED, and I'm really excited to work with the rest of you to get this standard super strong.
Thank you so much. This is so exciting. I'm hyped. I am kind of surprised that I'm so hyped about this, but I am. So without further ado, I am pleased to introduce Christy Peck from the New Mexico Environment Department, Occupational Health and Safety Bureau. It's wonderful to see you on this side. We used to work together when I was at NMED, and I'm just thrilled to be working with you again. Take it away.
All right. Thank you so much, Justin. And thank you all for your presentations covering what our rule covers and what we can do better. And really the impact that heat has on New Mexico workforce and why this is so important. So I appreciate all of you and your presentations earlier. Just briefly want to jump on, next slide, please. I just briefly want to jump into how all of you can participate in commenting on our rule. So we have a public comment period. It's open for 60 days. It opened on April 1st, 2025, and it will be open through May 30th, 2025. New Mexico, sorry, the law requires a 30-day comment period, and we are actually keeping it open for 60 days because we want to elicit really good, strong comments from the public, from labor organizations, from workers, from industry, so we can create a really strong rule that will be something that's successful, that employers can implement successfully, and that will protect workers. So we have a long window for our public rule or our public comment period. So again, April 1st to May 30th, you can reach that public comment portal in two different ways. The easiest way is to just Google New Mexico OSHA, and then there's a link that you can click for heat, illness, and injury prevention. And then on that website, specific to our heat, illness, and injury prevention rule, there's a link for the public comment portal, and you can go straight to that, find our rule, and you can enter a public comment there. You can also email us at heatrule.comments@env.nm.gov. That's another great way to get a comment over to us or ask questions, whatever it is that you have. We check that daily. That goes directly to myself and to some other members of NMED's Occupational Health and Safety Bureau and our new Compliance and Enforcement Division. So we're monitoring that. We will, respond when necessary or gather those comments, throw them in for our public comment period, and then have some responses to those as well. So the website that we have a couple of documents. We have our draft rule, so you can read through our proposed rule. You can read our public participation plan, our public involvement plan. You can read through our petition for a hearing for the Environment Improvement Board, which has been set. And that just gives a little bit of background as to why we're proposing a heat rule. So there's some information on there. We have some links to the NIOSH website on heat exposure. So there's some great information on our website. We are going to have an outreach week. The target date of that week is the week of May 12th. So our proposed dates are May 13th, 14th, and 15th. We're not 100% sure because they're not scheduled yet exactly which days will be which, but we're hopeful that we're going to have a general public virtual town hall session on May 13th. That's our tentative scheduled date. And so that's basically will just be an all-day session for anybody to join in, ask questions, give comment. It will be monitored. It'll be recorded. Any comments will be added to our rule and addressed. We will also have a business and industry stakeholder town hall and a worker advocacy and labor town hall. We have attending some of these different outreach events, such as this one, as well throughout the months of April and May. And then, of course, there's participating in the hearing itself. The hearing is scheduled for July 16th and 17th, with potential spillover into the 18th if necessary. And anyone is allowed and encouraged to participate in that hearing. Individuals can even provide technical testimony if they would wish to in support of this rule, or, you know, when they have something that they think should be done a little bit differently, right? So we do encourage you all to participate in our hearing on July 16th and 17th. Next slide. So just a quick timeline again to reiterate, our draft rule was completed on March 12th. We submitted it and the petition to the Environmental Improvement Board on March 13th. We've opened our public comment portal. That period will run from April 1st through May 30th. So it is live. You can, as soon as this meeting is over, you can jump over to it and submit a comment if you would like. We'll have that outreach week, the target date of the week of May 12th, specifically the 13th, 14th, and 15th. And then our hearing is July 16th and 17th, with that spillover into the 18th. Assuming that the Environmental Improvement Board approves our rule at the end of this session, at the conclusion of the hearing, we will anticipate that the rule will go into effect around the middle of August. We have to get it to the registry before it becomes effective, and based off of dates, it looks like it would hit the middle of August. Of course, Environmental Improvement Board does have the ability to deliberate after the hearing concludes, so it could extend the timeline, but we're very hopeful that we're going to present a very strong rule with strong testimony and get this adopted at the conclusion of the hearing. Thank you.
Thank you, Christy. Next slide. So this is just a summary of the timeline for action. And as advocates, we hope that we will be helping them get it over the timeline with the recommended improvements that we hope that you'll join us in advocating for. So again, this is a summary. It sounds like start date is more like mid-August. Catching this summer, getting training in place, so clearly that next year our workers will be more protected. I wanted just to highlight that CVNN has created a website, Safe Work for All, and it's through Climate Action Now NM, and we'll be sharing that information out. But through that website, you can do 4 different things. We will have a link directly to the NMED portal for comments, and those will be able to be given in English and Spanish, as I understand, Christy. Obviously, their email, anyone who wants to give comments, they'll find a way. We just are so grateful for NMED's partnership, I have to say. What we need particularly now is lots of public comments. We're going to create a petition so that we can, have several thousand people, at least 1,000 here in New Mexico, saying that they support this. But we also need worker stories, which can be given by workers themselves, loved ones of workers who are concerned when their partner, their dad, whoever goes to work, and what is happening to them when they come home exhausted and wiped out. So worker stories, and we also want organizational support. We have a lot, as you saw, of partners, but both state and national organizations who are supporting truly a remarkable effort by our NMED to put in place the best possible things. So Safe Work for All. Thank you, Justin, for putting in the standard. And so there are lots of different ways, of course, media, earned media, writing an LTE, getting the word out, because this is something that most New Mexicans will support. We know that there will be opposition, concerns by businesses who are concerned about additional regulation or anything, any extra steps that they'll be required to take. But our workers' health and safety deserve our support. And we also, I just want to add, maybe hosting some events if you have ideas, any ideas about how we can, in this short time frame, right? Public comment between now and May 30th, and then the hearing in mid-July, how we can really let the EIB know this is something New Mexicans want and really will set a standard for our nation and model. So this is time for questions. And we'll stay on. I'm sorry, you know, everything always takes longer, right? This is our first opportunity to share.
Shelley, who exactly are we expecting to be opposing this? I would assume chambers of commerce, and some other specific industry groups perhaps, but what's the thinking? You said we expect opposition.
Great question, Charles. I think I'm going to let Anastasia, because she has the broadest experience from other states, ask it. And then Michael will have you ask it next.
Yeah, I would say there is often some industry opposition. Sometimes some of it feels a little knee-jerk. You know, sometimes it is some legitimate concerns about how are we supposed to know exactly what it is we're supposed to do, or how are we supposed to implement this in a particular time frame. And I think that when those concerns are brought in good faith, they can often be addressed in a pretty reasonable way. We do have many years of experience for states that have had these standards in place. So I think we know to what extent these things really are doable. There are sometimes businesses that come in and say, well, I already do this for my workers, and so I don't want the regulation. Of course, that's great for them. This means their competition will have to do it too, you know, so it actually will put them at a competitive advantage. But it's generally a pretty standard group of opposition. And I see that Michael has his hand up too.
Yeah, I had a question, but just a comment. I could see groups like NIOP, or others like that. Those they're in the building industry do it. So I had a question about the comment process. So the current comment period is part of NMED collecting information so it can modify, if it chooses, the final proposed rule to the EIB, and then the EIB will have its own comment period prior to the hearing. Is that correct?
Christy, can you clarify?
Yes, so that is correct. I'm not 100% sure on the EIB portion of it. So what I can do is get that information and then get that to Shelley and Justin so that I can respond correctly to the EIB portion. The public comment portal is actually open through the conclusion of the hearing on July 17th. So I do believe that the portion between May 30th and July 17th will likely include comments that have something to do with the final rule once, of course, we submit that to the EIB. But I'm not 100% sure, so I will make sure I get an answer for you on that one.
Okay.
And I'll just say, Michael, I'll just say from other experience I've had with the EIB, they are required to read all comments.
Yes. So that means then that every comment from the 1st of April through the end of the hearing is part of the board members' packet. Okay, so it's more directed at the EIB than at NMED to modify the rule, or it's the comments for the next 2 months are doing double duty?
So the comments through May 30th will be for us to evaluate, respond to those that would require a response. Or that there may be a group of comments that are all virtually similar. And so we'll provide one response to multiple comments, hopefully. And then we will evaluate if there are any changes to the rule that are necessary before we submit that final rule. We will only be evaluating comments through May 30th for what we provide for changes that we may make to the proposed rule. The comments between May 30th and July 17th, I believe that's the part that's going to go to the EIB. But I'll double check on that. But for us, we'll stop reviewing after May 30th for inclusion into how we adjust anything for the final rule. Does that clarify that?
Yeah, thank you.
You're welcome.
Thanks
I
so
saw-
much.
Yeah. Before we do that, Justin, I saw that Rebecca Rendell, who's the Health and Safety National Coordinator for AFL-CIO, I thought maybe Rebecca, who just returned from India from a heat conference, might introduce herself and just say a brief word before we close.
Hello all. Oh, I'm a little blurry. Hi, my name is Shanae Arbery. I'm the Senior Health and Safety Specialist at the AFL-CIO. We have a number of our National Health and Safety Committee on the call. Rebecca she is on. Rebecca, do you want to say anything? Oh, maybe not. Anyways, it's been a pleasure working with Healthy Climate New Mexico and NELP and all the partners on here as we engage and try to very much strengthen a heat standard in New Mexico. So thank you everyone for joining.
Thank you so much. Charles, I see your hand up. Do you have another question? No. Okay, Brian.
Thank you. Are there any allowances for what is extreme heat versus the beginning heat health thresholds? Is there such a change in behaviors by workers and managers for what might be termed extreme heats, if that could be clearly defined? Thank you.
At the 95-degree threshold, that is when the preventive brake schedule would then go into effect, and the rule includes a table that would lay out how that's done. So there is sort of a two-tiered system. There is not currently something for, say above 105, or 110, which some states that have a lot of heat are considering. But it does have the two-tiered system. So one set of protections goes into effect at 80 degrees, and then another set goes into effect at 95 degrees.
Thanks so much. Charles.
Yeah, thanks. Sorry, I didn't get my audio on quick enough last time. Okay, so the question is around employers that say that they have some kind of heat standard that probably doesn't measure up to what we think is required to protect people's health. Do we have, is there any thought to doing something that was done in a way for the paid family medical leave proposal, even though it failed? There was a provision, there was language in that talked about if an employer has something that meets the requirements, but doesn't necessarily do it exactly the way that we're saying, that they could be certified as being okay or whatnot.
I have not seen language to that effect in the current standard. There are some circumstances where if heat protections have been collectively bargained between workers and employers in some states, so long as those standards are at least as strong as the standard, they'll be allowed to do those instead, because it is a legally binding document between it's a contract. But I think that part of what we want to do is make sure that everybody is protected. And so a voluntary standard that wasn't in some way enforceable probably should not replace these protections.
And if I may just add,
Yeah.
a little bit here. The litmus test is whether your protocol is as effective or more effective. Then the burden becomes on them to show how is your protocol being as effective or more effective. Do you want to take measurements of every worker and do it? Sure. Why? I mean, that would be how this is determined. I think the OSHA regulation also went through this in a lot of discussion into how do we determine if someone has a very effective protocol or not.
Thank you so much, Dr. Al-Ahmed. Louis.
Hi, folks. I just wanted to reach out. It seems like the short list of orders for us is to comment on the rulemaking and then go to these meetings in May. I wanted to find out what other work we can do as far as organized labor to help push this through. Like, what do I need to be rallying my members around? And then for Dr. Ahmed, if you could please put something, I want that Nicaragua study. So if you could put something in the chat where I can email you and get it later, because the screenshot won't do justice. I'll get challenged on it. So I wanted to get something for it. Thanks, folks.
Thanks.
I'll just say thank you so much, Liz, for your question. Please make sure we have your contact information, or I know Organized Labor is going to be organizing their own information session. But yes, comments on the rulemaking, obviously positive comments with recommendations. We will be producing a summary of the recommendations, which we'll have out hopefully by the end of this week, certainly by Monday. Second of all, worker stories. We need to hear from workers. It can be anonymous, it can be named, it can be from a worker's family member, it can be from a health professional who works with a worker. They're concerned about what you've heard, but there's got to be worker stories. They're the most powerful form of data we have. Thirdly, any businesses who support this, any employers, if we, even one makes a difference to the EIB, I have to tell you. And I know there are more than one. I heard about a restaurant that's doing things because it levels the playing field for people who want to protect their workers. So if there's a business that's already doing good heat protection, let's have them speak in favor of this rule. And then finally, we want organizational sign-ons. So that's safe work for all. Let's put it again in with the shorter URL, right, Justin? And maybe you can say something about that in closing. Please make sure we have your email contact. Like I said, we may also be organizing events. And Louis, if there is an LTE, a letter to the editor, an op-ed from Organized Labor, this ideally will be driven by workers, health professionals, people who care about environmental issues and see the impacts of climate change. But it is the workers themselves that this is for. So we'd love to see worker leaders and would love to find ways. I will say one other thing about workers. Any worker who's willing to talk to the media would be a powerful thing. I think we'll be looking at some kind of press conference, but we need worker voices. And we know in other states, workers have been key advocates because obviously those who feel safe enough to do it, I mean, there's an issue of, making sure they're protected. But that, we want everyone who's working to be healthy and safe.
Thank you so much, Shelley. I put the short URL in the chat again. It's safework4all.org, safework4all. It's a work in progress. We will be updating it regularly, shifting some things depending on how our campaign changes, but go there for the latest and greatest. And Louis, please, if you could send your email to Shelley or I, that would be great so we can get in touch. Garth, I see your hand.
Hi. I have a question actually for Anastasia. Thank you, by the way, for the support on the rule and your comments were great. I mean, that's our kind of our first set of constructive comments. We're looking probably to get ourselves torn apart this afternoon. We're going to have an industry meeting. But no, I really liked your question. Or your suggestions. A lot of the suggestions are things that we had actually kind of batted back and forth, and I'm wondering kind of one of the concerns that we have putting things into the rule is enforceability, right? And simplicity and enforceability to some degree, and one of the things we will make clear is that this is not, the rule itself, the enforceable part is not the end of it. There's also best practices and things that, things that are great to do, but it's not necessarily something that we have the ability to enforce. And I'm just wondering, with your experience with other states and things like that, where do you think that line falls in terms of enforceability versus, things that we can advocate for in best practices?
Yeah, thank you. That's a great question. And you're right, that you don't want the thing to become so unwieldy that employers start to feel intimidated or frightened by it. There have been many occasions in other states where employers have actually asked for some of this specificity. Help me understand, I'm not a scientist. Help me understand how to monitor the heat in the workplace. Help me understand what a good heat plan could look like. And some of that can be done in guidance. Some of that can be done by giving them sort of a template for a plan that they could start to build out for themselves. So we could certainly talk about some of those tools that other states have provided on top of the regulation to help employers, because we do want them to be able to comply with the rule. I do think that sort of recalling that their general duty is to make sure that they're providing a workplace free of workplace hazards is a really good guiding rule, right? So what do we think they need to know, and what tools do we think they need to have in order to do this? And one thing that might help is considering writing into the regulation sort of a commitment from NMED to revisit this and revise it and, sort of use what we learned from it. Many states have had to do revisions. I'm in Washington State. They just have done revisions on their heat rule in 2023. California has done revisions on theirs. So it can and should be an iterative process. And I would be happy to pull some of that language and share it with you.
Great, that'd be awesome. Just another thing that is something to think about is that we're going through another process with the federal OSHA's walk-around rule where we want to adopt it, but there's just like a one-word change in in the law where we have to change that. We have to change the law in order to adopt it. And it's a big process. So, it goes through even though it's just a one-word change, it goes through the same EIB process. And we don't want to get backed into that kind of corner either. So in some areas, by being too specific, we don't want to hurt ourselves in that sense. Just thank you. I appreciate it.
All right. Thank you all so much for hanging out with us on this lovely Tuesday morning in April. If you have any other questions, feel free to reach out to us. Go to our website. We appreciate you caring about this topic. I know it's a little niche, but it affects a lot of the people that we hold near and dear to us here in our state. Shelly, any closing words?
No, I just thank you so much to the whole presenting and organizing team, and we really look forward to working with all of you to get the best possible standard to protect over 250, about 250,000 workers, and to expand all of our heat protection policies here in New Mexico. So really, really grateful for your participation, and we look forward to being in touch.
Thank you all. Have a good day. Take care.
Thank you.
Thank you.
Thank you, everyone.
Yeah, Whitney, I see. Oh, she's gone. It's great.
Yeah, thank you.
Did we stop the recording?